Wonderful.
When we go about selecting employees, we have a very high standard. We look for employees that have a lot of experience, especially with a lot of the common diseases that we're dealing with in home care. And we're also really looking for that type of employee that is in the business because they care about people.
I like school, says Big Bird.
I think Prairie River is a good company to work for because they're family owned and it really feels like you work for a family. I've worked for other companies where you just feel like you're kind of a number, but working for Prairie River, I know I work with a really great team.
The nurses that we have here at Prairie River Home Care, they're very passionate about what they do. They really love home care. They are very clinically sound and their documentation is great, and they care about their patients and they're advocates for them when they are needing things in the community, that we are making sure we're following up with the doctors, the families, and the social workers, and anybody else that might be involved with them.
So I'm excited to be working here with Prairie River. Pretty nice company, and we get a lot of support from the staff in the office, especially when we have some needs we want to make. They kind of respond so well. And they also make visits as many times as they wish. So we kind of get the support from the parents, from the office, and from the hospital.
There's just a couple things that aren't on the agenda that I wanted to talk to you guys about.
We provide continuing education for our clinicians and our paraprofessionals on a monthly basis, quarterly basis, and yearly. We are always trying to stay on top of infusion changes, wound changes, and even any transfer techniques, any personal care techniques that we might be able to help them provide better care for the clients. We are providing that on an ongoing basis for our employees.
How we treat our employees is equally important as how we treat our clients. And I really feel that how we treat our employees really spills out into how the employees then care for clients. All of our employees go through an extensive background study in order to assure that not only are they quality caregivers, but they're also somebody that you can feel comfortable with and trust in your home.
You'd sit up better here, Talon. Yeah.
We tell our branches that are interviewing and hiring employees, always ask yourself, is this somebody that I would want taking care of my family member, my child, my mother?
Specialized care that we're known for, we do a lot of wound care, wound vacs, we do a lot of infusion therapy, IVIG, PICC lines, portacaths, we put in peripheral IVs, we do Synergist for our babies in the winter season. We do a lot of education, med management and diabetes and congestive heart failure. A lot of things that hospitals are looking at improving in the community. We really stress the education piece on that to make sure that our outcomes are good for us, the patient, the community, and the hospital.
Some of the things that I think really make our company stand out from other home care companies in the area is that we have a very strong clinical management team. Most of the managers in our corporate office are RNs, so they really understand what it's like to take care of patients.
I inspire the staff to provide great service by leading by example. I was a case manager prior to being a general manager, so I understand what they're going through out in the field, and I understand the dedication and time that it takes to be a case manager, home health aide, physical therapist, or any other discipline in Prairie River Home Care. So I try to relate to them and support them in any way that I can.